Hello everyone, today we will be talking about coronary heart disease and its effects on the average life expectancy in different countries. Along with discussing some lifestyle changes people can implement to reduce the risk. We will also see what an expert cardiologist thinks about today's world. So what is coronary heart disease and why worry about it? According to BHF, coronary heart disease is when your coronary arteries become narrowed and blocked by a buildup of fatty material within their walls. These arteries supply your heart muscles with oxygen-rich blood. This is sometimes called as ischemic heart disease. Also, as per the WHO, CHD is the highest death-causing disease, which is responsible for 16% of global deaths. But even though it's important, it is still highly neglected. Out of 50 students we surveyed in our school, only 34 knew about CHD, and the information they knew only consisted of the definition. Furthermore, after informing them about CHD, 25 of the students knew some of their relatives to be diagnosed with CHD. This shows how important but neglected the problem of CHD is. How does CHD develop? Coronary heart disease is caused due to the buildup of fatty substances on the inner walls of arteries. This buildup hardens and narrows the arteries, making it difficult for the blood to flow and eventually leads to blockage in the vessel. CHD has several adverse effects on the human body, which include high blood pressure due to the narrowing of arteries, chest pain due to the insufficient blood supply to the lungs, shortness of breath due to lack of oxygen, and stroke due to blockage in brain's blood supply. CHD also leads to heart attacks. This happens when heart muscle stops working due to insufficient oxygen supply and the heart stops beating.
So, how does CHD affect the average life expectancy of various countries? Let's first know what is average life expectancy. According to our world in data, life expectancy is the number of years a person can expect to live. And so, the average life expectancy of a country is the average numbers of years the country's people are expected to live. CHD can decrease the average life expectancy of an individual, and research suggests being a victim of heart problems can reduce a person's average life expectancy by up to 10%. For example, if a normal person has a life expectancy of say 80 years, they may live for 80 years. But another person who has the same expectancy but also has CHD may only live for 72 years. So, we know that CHD can potentially reduce one's life expectancy, and if many people are affected, it can collectively impact and decrease the country's average life expectancy. So, let's see with an expert what are some causes of spreading CHD.
Has the number of CHD patients visited you increased in the recent years? If yes, what can be some reasons for this change?
So, number of ischemic heart disease patients have definitely increased in recent years. And the reason behind this is increase in incidence of diabetes and hypertension. Apart from this, recent lifestyle changes, type A personality. If you can understand, type A personality means competitive personalities. I want to achieve this, I want to do this, which is leading to sedentary lifestyle and less exercise and more prone towards junk foods, easy availability of alcohol and smoking, even in young patients, even at younger age. These are one of the important causes of increase in number of CHD patients, ischemic heart disease patients, IHD patients. Yes. Next question.
Do genetics and age play an important role in being a victim of CHD?
Definitely. In everything, genetics and age is involved. Whether it is bronchial whether it is allergy, whether it is diabetes, hypertension, and as I am telling you, this is a non-communicable disease, multifactorial disease. Means if somebody gets ISD, means there may be underlying hypertension, maybe underlying diabetes, underlying stress, underlying obesity, age factor, family factor, and all these things are per se associated with genetics. So ultimately ISD becomes associated with genetics and definitely age. Yes.
The factors that cause these differences are the healthcare sector, which means how developed the treatments in the country are, the food habits, which means what the country people usually eat, and the average income, which means how much a person annually earns. So let's start with USA and Australia. Firstly, US and Australia have good healthcare sector with high quality of medicine and well-maintained hospitals, which means that most of the patients are cured. Secondly, people in these countries eat a lot of meat and fat containing foods, which are proven to increase the risk of developing CHD. Lastly, they have high average income, which means more people can afford this rather than expensive treatments.
Now, let's compare South Africa and India. These countries don't have any of these facilities. The healthcare sector is especially undeveloped in South Africa, giving a high death rate. Secondly, many parts of these countries experience severe hunger, making the lack of food choices which already exist worse. Lastly, there is a high rate of poverty in these countries, making it difficult for people to afford healthy food or basic treatments like angioplasty, exposing them to a greater risk. Quite unsurprisingly, developing countries have a greater risk due to CHD, resulting in a higher death rate and more chances of decreasing the average life expectancy. These results, as we know now, are due to the difference in the healthcare sector, food habits, and average income.
So, what are some lifestyle changes to reduce the risk of CHD? Firstly, the most important change is to quit smoking. Smoking causes most cases of plaque formation in people under the age of 50 and is related to many other diseases like bronchitis and mouth cancer as well. Secondly, improve your diet. Reducing the number of saturated fats in your meals and avoiding those tempting fast foods will minimize the chances of blocking your arteries. Thirdly, avoid excess stress in your life. In today's modern world, people are often under stress due to their exhausting jobs and family issues. Stress can cause inflammation and increase blood pressure, increasing the risk of developing CHD. Lastly, have plenty of exercise. Exercise makes your heart muscles more robust, lowers stress and cholesterol levels in the blood, and arguably is the best way to keep out of the reach of CHD. So, can these changes decrease the impact on the average life expectancy? The answer is a big yes. If everyone makes these changes a part of their life, this will collectively lead to a decrease in the impact due to CHD and may increase the country's average life expectancy.
To conclude, CHD reduces the average life expectancy of a country, but this decrease may vary from country to country. As our research shows, developing countries like India have a greater risk due to CHD as compared to developed ones, and improvement in medical facilities and modernization is decreasing the number of deaths. We all saw some lifestyle changes that can reduce the risk and how they can increase the average life expectancy in the country. Thank you for watching. Hope you found this video informative and useful.